Okay, good afternoon. We'll go ahead and get started, and we'll start with an update from the number of cases of COVID-19 in Iowa that was released earlier this morning. Today we have 19 new positive cases for a total of 124 positive cases in Iowa. 272 total negative tests were negative today for a total of 2,315 negative tests and a total of 2,439 total tests. That includes 4 new counties: Buchanan, Cedar, Jasper, and Warren, for a total of 30 counties. We have 18 hospitalized as of last evening, 17 as of right now. We had 1 discharged from the 7 last night. We had 2 that were, 2 of the new were recovering at home, and 9 of those hospitalized were already in the hospital and tested positive based on the criteria that we're using for testing. You know, since the day that we first learned of COVID-19 was here in Iowa, I've asked Iowans to remain calm and to stay informed. Having the most up-to-date information from credible, reliable sources is so important during these times. I made a commitment to do my part to keep Iowans informed, and today I want to take the time to thank some of the people who have really made that possible. To the Homeland Security and Emergency Management and the Iowa National Guard, thank you for standing up the State Emergency Operations Center, and for making sure those of us who are leading the response effort are informed and prepared to deploy the necessary strategies and policies. To the incredible team at the Iowa Department of Public Health that is truly on the front line protecting the health of our people, thank you for making sure that Iowans have the information and the know-how that they need to make a difference. To Director Claybaugh, Dr. Padati, and Sarah Reister, and to the staff manning the 211 call center, your expertise is reassuring to Iowans during these challenging times. Finally, to my team here at the SEOC, I want to thank you for supporting me and the Lieutenant Governor each and every day. And to the rest of the team back at the Capitol, Team Capitol, thank you for taking every call and answering every email and letter from Iowans looking for answers. I want you to know that you're making a difference. Each day, my office issues a press release with the daily update of the number of positive COVID-19 cases in Iowa, with the age range and counties of residence for each of the affected individuals. This information is also posted on the Department of Public Health website and on a new website launched earlier this week, which is coronavirus.iowa.gov. The new website is intended to be a one-stop shop for Iowans looking for any type of information related to COVID-19 mitigation and response efforts in our state. The website will guide you to a variety of useful information from state agencies on topics such as health and human resources, employment and unemployment, business, education, travel and transportation, as well as public safety. I will also continue to hold press conferences on a near daily basis to update you on timely information, and you can, of course, tune in live on my Facebook page and on iowapbs.org. And I also want to extend my gratitude to Iowa PBS for their public service during this time. They've made it possible for us to implement social distancing measures here at the SEOC that protect our team as well as the media, and we greatly appreciate that partnership. Finally, for the latest information about COVID-19, how to prevent it, and what to do if you're exposed or become sick, go to the cdc.gov for the most up-to-date, accurate information. You can also tap into your favorite media outlets for information and stories about COVID-19 and how it's affecting our state, nation, and countries around the world. And then there's social media, which can be both a blessing and a curse during these challenging times. Be intentional about how you are using social media. If you're looking for news and information, follow credible sources. Don't just rely on what pops up in your news feed. Social media is a great way to stay connected with friends and family, especially while we're social distancing and spending more time at home. But it's also ripe for misinformation, false narratives, and harmful rumors. Rumors and speculation are not helpful at a time like this, and don't be a part of it. It only adds to the anxiety that so many people are already experiencing. So know the facts. We are reporting positive cases daily, and the Department of Public Health and local public health officials are working with those individuals and those communities. And if you have questions about how to treat the virus, check the CDC website or talk to your doctor. It's so important that we don't get distracted by the noise and that you get the information from credible, reliable sources. So please stay informed, again, remain calm, and take all preventative measures to protect your health and the health of your fellow Iowans. Wash your hands, cover your cough, work from home if you have the option, stay home as much as possible, practice social distancing, and don't put yourself or others at risk of exposure. We can do this, and I'm counting on all Iowans to help us as we work through these unprecedented times. So with that, I'd like to ask Sarah Reister from the Department of Public Health to say a few words. Sarah?
Thank you, Governor Reynolds, and thank you to all Iowans who are following the guidance of the governor and the Iowa Department of Public Health in practicing social distancing, avoiding gatherings, teleworking, telelearning, staying home when you're ill, and continuing to use good personal hygiene habits like washing your hands often, covering your coughs and sneezes, and cleaning surfaces frequently. We've heard your questions about shelter in place or stay-at-home orders, and we appreciate that Iowans want to do everything possible to keep themselves, their loved ones, and their communities healthy. While sheltering in place is a tool that is currently being used in other states, we do not believe it is a mitigation measure that is necessary in Iowa at this time. It's important to understand that sheltering in place for 2 or 3 weeks will not cause the coronavirus to go away. That's because this virus is circulating around the world and can be reintroduced into communities from different places. There is no current treatment or vaccine available at this time, and that's why it's so important that we use the public health mitigation strategies that are available to us at the right times. Mitigation strategies recommended by public health are used as part of a layered approach intended to slow the spread of the virus in our state. The Iowa Department of Public Health will continue to recommend implementation of additional mitigation strategies when we determine those additional strategies to be necessary. As we move through this public health emergency, our recommendations may change over time, depending on the data we see about how this virus is impacting our communities. We may recommend adding more stringent mitigation strategies, and we also may recommend lifting mitigation strategies. Think of this as a dial and not a switch. We will recommend turning the dial up and down over time. That's how we will slow the spread of the virus in our state in order to prevent overwhelming our healthcare system and to protect our healthcare workers and our vulnerable populations. Right now, public health has recommended a number of mitigation measures. These include school closures, increased teleworking and telelearning, limiting unnecessary travel, especially among our high-risk groups, which include Iowans over 60 and those Iowans with underlying health conditions, limiting visitors to healthcare facilities, avoiding gatherings, staying home when possible, and social distancing when we do need to be out in the community. Metrics that we are looking at when we make recommendations about mitigation measures that should be implemented include the percent of our population that is 65 or older. This tells us how many members of a particular community might be vulnerable. The percent of identified cases requiring hospitalization. This tells us how severe our identified cases are. The rate of infection per 100,000 Iowans in the past 14 days. This tells us how many cases exist in a community within the most recent incubation period of the virus. The number of outbreaks in settings like long-term care facilities, where our older populations and Iowans with underlying health conditions live. This tells us about clusters of illness that exist among vulnerable populations in a shared community setting. We look at all 4 of these factors in addition to information about the experiences of other states in making recommendations to Governor Reynolds and to our local community partners about what mitigation strategies are appropriate now to control the spread of the virus in our communities. We are analyzing this data daily and will continue to make recommendations necessary to slow the spread of the virus in our state. We know that this is a difficult and uncertain time. Public health will continue to make the right recommendations at the right time, and we appreciate you sharing these messages with your family, friends, and neighbors. We all have a role to play right now. Stay home as much as possible to avoid potential exposure to the virus. That's especially needed for those of you who are over 60 or who have underlying health conditions. Practice social distancing when you do need to leave the house. Work and learn from home if possible. Avoid large gatherings, and call ahead before visiting your healthcare provider if you do become ill with a fever, cough, or difficulty breathing. Clean surfaces regularly, and always practice good personal hygiene like hand washing, covering coughs and sneezes, and staying home when sick. Thank you.
And with that, we'll open it up for questions.
Governor Reynolds, yesterday, President Trump cited Iowa's statistics in his desire to reopen the country as quickly as possible. And today, he mentioned he'd like things to get back to normal by Easter. Is that your desire as well?
Well, we want to get things back to normal as quickly as we can, and that's why we've taken the various steps that we've taken, because all along, by implementing the policies and procedures that we put in place, we've done that as a means to bend the curve and hopefully prevent overwhelming our hospitals and our public health workers. And so that's been the intent all along. And if we can do that and we start to look at some of the metrics that we're evaluating different areas of the state, that will also help us in making our decisions to bring parts of Iowa back online as well. So as long as we're continuing to work and base these decisions off of the data that we have, taking into context what other states are doing and what some of the CDC guidelines are, then I hope that's really how we can strategically and systematically maybe look at areas that we have to make some different decisions about, and look at other areas that we might be able to start that process to bring some of these businesses and open up some of the restrictions that we have. I'm not prepared at this time to say a date because all along the decisions are so fluid. What I say sometimes at a press conference after we receive new data, I have to stand in front of Iowans the next day and I've made a different decision. But that decision has been made based on the data that the Department of Public Health and their expertise has provided us, along with other factors that we've taken into account as well.
So in the instance when you would have hotspots that would still have restrictions, would you defer to mayors and county boards of supervisors, or would you make that decision?
Well, I think we would work with them, and if we take a look at the metrics that we can provide them some of the data, working with them, it would let us know perhaps if social distancing is being followed or if it's working. Are there additional measures that we can take to help get the message out and help bend the curve and maybe prevent us from taking that final step of asking people to shelter in place? It would allow us to really assess the regional health care opportunities when it comes to PPE, protective personal equipment, or workforce capacity. So that's also a factor that goes into those decisions that we're making. So really, when we have the same criteria and we're consistent in what we're basing our decisions on, that helps mayors, that helps communities, that helps our healthcare partners. It helps us all feel confident as much as we can be with a very fluid situation in making the decisions and the recommendations that we are moving forward.
May I ask a kind of follow-up to that?
Yeah.
Two-part question. First, are you willing to make your own independent decision, even if the president makes a different decision for the nation? How do you protect Iowans on your own basis? And the second part of that is, how do we know when we've bent the curve? Is there some metric or measurement to give us an indication of, okay, we've gone far enough, now it's safe to open up commerce again?
And chances are, even though we flatten the curve and we work out of it and we're bringing industry back on, there's the potential until we get a vaccine or that it's going to tick back up at some point. So we have to take that into consideration when they're making these recommendations. I'm going to base my recommendations on what I'm seeing in the state of Iowa based on the data that I have, but one of the elements that we look at is what's happening in other states across the country. So at least twice, if not 3 times a week, I have the opportunity to jump on a call with governors from across the country at least 1 time a week. That includes the vice president and often the president, so we can get an up-to-date overview of what's happening at the federal level, things that we need to be looking for and taking into consideration some of the data that they're seeing in states that have really become hotspots, and then to have the opportunity to talk with governors and find out what their what the metrics they were using and what did they use, what kind of criteria to make some of the decisions they made, when and how is just helpful. But you have to take a look at your own population. We're not as densely populated as New York. We're more of a rural state. We have pockets of more densely populated communities. So all of those factors go into that. I know, Sarah, do you have anything to add to that?
All those folks who are hospitalized, do we know how they're doing? I mean, obviously there are various levels of how one would be in the hospital, ventilator, et cetera. Do we know how they're doing? I don't know if Sarah might know that or what.
Sorry, I don't have that level of detail to share at this time.
Is there a reason why we've seen such a jump? I mean, from 7 to 18, it seems like
It's still a relatively small hospitalized patients with a fever, respiratory failure, and no other diagnosis that they can tie that to, that were already hospitalized, that they had tested and found out that they tested positive.
so among hotspots that we have in Iowa, kind of 30 counties in Iowa, that indicates anything you could say to Iowans about the shape of the spread or the contour of the spread that tells us anything, what we could do about that?
Yeah, I think what I would say in response to that question is, the governor announced, I think it's been a week and a half ago now, that we had community spread of the virus in our state. And there's a 2-week, roughly incubation period for the life cycle of the virus. And so I think that the spread that we've seen is what we anticipated. And we anticipated, and we do anticipate we're going to continue to see our case numbers go up this week. So that's what we're hoping to see, that over time those increases will kind of slow down, and we do anticipate the virus is going to flatten the curve so that we don't have a peak in cases all at once and overwhelm our healthcare system.
Sarah, for you, but I probably want to hear from the governor for thoughts on this as well. Yesterday we had a reporter who asked how many beds ICU information's confidential as part of emergency protocols. But you look at California, New York, Illinois. For example, Illinois is telling they have 1,700 has. Why is that information being kept from the public when other states are releasing that information?